Hello, everyone. My name is Maria Rodriguez, and this is my final capstone presentation. So, just a quick introduction to the presentation. The public issue that I have chosen to work with this semester is the prevalence of type 2 diabetes, specifically in the Hispanic and Latino populations here in the United States. The reason why I chose this public issue is because the Hispanic and Latino populations are projected to continue growing in the United States. And so bringing awareness to this issue is going to help us provide culturally competent care as future healthcare professionals. My personal connection to this issue is that I was raised in a Hispanic community of lower socioeconomic status and was able to see firsthand the detrimental effects of uncontrolled and unmanaged type 2 diabetes and all the effects of misinformation. So, for my effective communicator experience number one, it was when I was working as a health assistant in a community health center here in Omaha, and I had to deliver very sensitive information to a patient. Essentially, at the community health center, patients were given a pain contract if they were prescribed a controlled opioid medication. And during that contract, they agreed to have their blood drawn or have like a urine drug screen. But if it came back positive for any sort of illegal or uncontrolled substances, then that pain contract was now broken. And so they unfortunately were no longer able to fill that prescription medication. So it was a particularly busy day at the clinic, and we were short staffed, and I was asked to deliver that information to the patient. I had never had to do something like that before, something so impactful as to, hey, we can no longer fill your needed pain medication. However, I kept calm and brought the patient back from the lobby, and we sat in an empty exam room, and I explained the pain contract has unfortunately been violated. We did find drugs, essentially, unprescribed drugs in your drug screen, and so we're unable to fill it. So I learned about the importance of keeping communication and messages clear and factual, and also my communication style, not letting my own nerves or inexperience get in the way, but just trying to connect with the patient. So for the application portion of this, important to keep my messages clear and concise. There will be difficult things to communicate with patients that have type 2 diabetes if their blood sugars are uncontrolled, if they have a history of being non-compliant, then it will hopefully help decrease their fear and hopefully have a better rapport with them if I keep my information clear and concise. For my effective communicator experience number two, I am currently working as a Spanish interpreter at a hospital here in Omaha. And during this particular situation, a Hispanic mother and her children had been waiting in the emergency room for a really long time. The mother was increasingly getting frustrated with the situation, and so I was being repeatedly called up by the front desk staff and asking to relay the same message, that there were a lot of emergencies and that the ED works on a scale of priority. I was called up there like 4 to 6 times, and around like the fifth or sixth time, I realized that I needed to tailor the way I was communicating and sending that message. And so I took some extra time to listen to the mother, see what her concerns were, and say, it's not because you're not important or your family's needs are not important. There's just a lot of respiratory emergencies going on right now. Unfortunately, it's just the way it is in the ED. If someone comes in that is really, really sick, they're going to be triaged and essentially seen first. Essentially, she shared with me that she thought that they had been waiting for a long time because they were Hispanic, And I said, no, your race has nothing to do with it. It is just the way the emergency department works. So from that experience, I learned about the importance of taking extra time to share information in a more thorough and effective manner. For the application portion, the issue that I selected of type 2 diabetes requires careful selection and tailoring of messages, especially with individuals that may have a lower health literacy level or that are just simply frustrated with the situation or with the health system as a whole. So taking the time to empathize, to listen, to connect and say, yes, I understand your frustration. This is what we can do, can hopefully provide better guidance in a more constructive manner for them. For my reflective individual experience number one, when I was in high school, I used to work at a garden center in West Omaha, and I was the only Hispanic individual there. And one of my coworkers, she would always refer to Mexico as being my home. She would always ask, "Oh, are you going back home for the holidays?" And Mexico is where my parents are from. It's not necessarily where I am from. It is my cultural and genetic background, but I was born and raised here. I consider Nebraska to be my home, and she would always ask about my cultural background, my cultural practices. And I was very young. At first, I was taken aback um, by all these questions and all this sort of prodding. However, what I learned from this experience is that there are so many different ways of communication and that a lot of people learn in different ways. Some people learn by reading, some people learn by asking. And so I really took the time to just think objectively and say, hey, I know you don't mean this in a bad way, but just having that open and honest communication. So what I learned is to just take a moment to formulate questions and to think that not everyone is asking questions about my cultural background like in a bad or like in a negative way. Some people genuinely want to learn. So for the application portion of this is that I'm going to have to use different techniques, different communication styles when I am teaching someone about type 2 diabetes that is maybe from a different cultural background than myself. Learning to ask about their preferences in a concise and respectful manner is going to be really important too. For my reflective individual experience number two, the situation was when I was at clinical one day, and I was asking a patient who their support system was while I was filling out my care plan. And that patient shared with me that their support system was their granddaughter. This was during the beginning of COVID, in which visitors were restricted, and a lot of patients were feeling isolated. They felt alone. They had maybe never been in a situation like this alone. And while we were chatting about that, then someone else walked into the room, relayed a message to him, and then left. He seemed frustrated, and I asked him if everything was all right, and he said, well, kind of. It's just that I have been here for quite some time and I haven't been able to get proper rest. People keep coming in and out, asking me questions, sharing information, which is okay, but it's hard for me because I'm here alone. So from that, I learned about the importance of creating a healing environment that encompasses a holistic approach for a patient. As we know, family members have such a big impact in the healing process, the recovering process. And so finding new ways in which we can bring in that support system is going to be really important for that recovery aspect. So for my application portion of this is I'm not going to ask my patients, who is your support system? Type 2 diabetes is a difficult disease. It can be hard to manage. Who's in your corner? Who's in your team? And also creating that healing environment. Like, how do you learn best? Would you prefer that we go to a private conference room with your support team, with your support person, and then relaying information in a setting that is comfortable for everyone and that enhances learning. For my change agent experience number one, this was also during clinical, a different semester, but essentially a mother was in labor, and I noticed that she was not getting the emotional support that she needed from her partner. She would repeatedly ask her partner, "Can you hold my hand? Can you walk with me? Can you maybe grab this?" etc. And he wasn't really receptive to her needs. And so when we left the room, I asked the nurse I was with, "Hey, do you think it's okay if I go back into the room and just sort of sit with a patient for a bit? Maybe we can talk, maybe I can hold her hand, maybe I can help her a little bit emotionally as she is going through labor." And she said, "Yes, of course." So I walked in and I said, "Hi, would you like for me to sit with you for a little bit? We can talk. I can bring you something. I can just hold your hand if need be." She said, "Yes, absolutely." So I held her hand. We practiced breathing exercises while she was going through labor and the contractions were intensifying. And once the baby was born pretty fast after that. And she thanked me and she said, "Thank you so much for being here, and just you sitting here and holding my hand really helped me through this difficult time." So I learned that every patient interaction matters. It doesn't have to be a huge gesture. It can be as simple as listening, as holding someone's hand. That emotional support component is going to be really big. For my application experience, needing someone to understand what we are going through is just as important as taking medications. Again, going back to that holistic approach, who's our support system, who's in our corner. Also, so my public issue of addressing type 2 diabetes requires emotional and cultural competence from the healthcare providers, the professionals. Again, looking at the whole person and what their needs are. For my experience number two for change agent, so it was during this semester for a specialized populations class. We completed a population-focused project that helped address a need in the community. We chose to collaborate with a Juvenile Diabetes Research Foundation here in Omaha, and we went to one of their events, and we had the great opportunity to share information about the foundation and living with type 1 diabetes. I learned about the importance of advocacy and education when it comes to disease prevention and management. What I learned about being a change agent can be utilized in advocating for type 2 diabetes in the Hispanic communities here in the United States, and advocating for them, like as a nurse, pushing for those social work consults if needed, but also on a much bigger scale, lobbying and trying to cap insulin prices, for example, are going to be important. So, in conclusion, I am hopeful that with the valuable knowledge that I have gained throughout my time here at Nebraska Methodist College, I will be able to be a change agent for my community. The experiences that I had during clinical and my own work experience have shaped me into being a reflective individual with strong communication skills. I am excited to learn more about how I can help shape the future of type 2 diabetes among the Hispanic and Latino communities here in the United States. Thank you.